and today I want to answer a question that men ask me all the time. Do erections really need to be rock hard? It's an honest question, and it's more important than you might think. Because erection strength isn't just about what happens in the bedroom. It's actually a window into your circulation, your hormones, and your overall health. So let's break this down step by step. In the next few minutes, I'll explain how doctors measure erection strength using something called the erection hardness score, what it really means if your erections are less firm than they used to be, the difference between performance hardness and health hardness, the hidden medical conditions that softer erections may be warning you about, and finally, practical science-backed steps you can take to improve your circulation and restore stronger, more confident erections. Let's start with how doctors actually measure hardness. Believe it or not, there's a validated scale for this called the Erection Hardness Score, or EHS. It goes from 1 to 4. Score 1 means the penis is enlarged but not hard. Score 2 means hard but not hard enough for penetration. Score 3 means hard enough for penetration but not completely firm. Score 4 means completely hard and fully rigid. Now, here's the key. You don't necessarily need to be at a perfect level 4 every single time. A level 3 erection, firm enough for penetration, can still be satisfying for both partners. But consistently falling below a 3 is considered erectile dysfunction. And even if you can still have sex, softer erections than you used to have may be an early warning sign that your circulation is declining. Why does this matter? Because erections are a blood flow event. When you're aroused, your brain sends signals through the nerves to the penile arteries, telling them to release nitric oxide. This chemical relaxes the blood vessels and allows blood to rush into the corpora cavernosa, the two sponge-like chambers in the penis. As those chambers fill, they compress the veins that normally let blood flow out, trapping the blood inside and creating an erection. If any part of that process is weakened, if the arteries are stiff, if the nerves are damaged, if the nitric oxide is too low, or if the veins can't trap the blood properly, your erection won't be as firm. That's why erection strength is such a powerful indicator of vascular health. In fact, softer erections are often one of the earliest signs of cardiovascular disease, sometimes appearing years before a man ever develops chest pain or has a heart attack. So when patients ask me, "Does hardness matter?" my answer is yes. Not just for performance, but for your long-term health. A drop from your normal firmness can be the body's way of saying, pay attention. Your circulation isn't what it used to be. Now let's talk about hormones. Testosterone plays a crucial role in erection strength. Low testosterone doesn't always cause erectile dysfunction by itself, but it does reduce desire, confidence, and the ability to maintain a firm erection. Cortisol, your stress hormone, can also interfere, as can thyroid imbalances. So if your erections are softer and your energy, mood, or libido are down, it's worth checking your hormone levels in addition to your vascular health. Another factor is lifestyle. Smoking, excessive alcohol, high sugar intake, lack of exercise, poor sleep, all of these chip away at your erection strength. Why? Because they damage the endothelium, the thin lining of your blood vessels that controls nitric oxide release. When that lining is unhealthy, your arteries can't relax properly, and the result is weaker blood flow where it matters most. Let's not forget the psychological side. Anxiety about performance, depression, relationship stress, these can all interfere with arousal and perceived hardness. The mind and body are deeply connected. If your head isn't in the right place, your erection may not be either. So what can you do if your erections aren't rock hard anymore? Here are the science-based steps I give my patients. Step 1. Improve circulation. Exercise regularly, especially resistance training and aerobic activity. Both boost nitric oxide and keep arteries flexible. Eat a diet rich in vegetables, fruits, nuts, and omega-3s. Foods like pomegranate, spinach, walnuts, and dark berries are proven to support endothelial function. Quit smoking and limit alcohol. Both are poison for penile blood vessels. Step 2. Manage hormones. Get your testosterone, cortisol, and thyroid checked. If levels are off, work with a doctor to restore balance. Prioritize sleep, since testosterone is produced at night. Step 3. Reduce stress. Meditation, breathing exercises, or yoga can lower cortisol and improve erectile function. Cut back on stimulants like energy drinks that worsen stress hormones. Step 4. Strengthen pelvic floor muscles. Kegel exercises aren't just for women. For men, they improve blood trapping in the penis, helping maintain firmness. Step 5. Seek medical evaluation. If your erections have suddenly weakened, get your blood pressure, cholesterol, and blood sugar checked. Erectile dysfunction can be the first warning sign of silent vascular disease. Now, I want to emphasize something. You don't need to panic if you're not at level 4 every time. Erections naturally vary depending on mood, energy, sleep, and stress. But if you've noticed a clear trend towards softer erections, don't ignore it. See it as a signal to take action, both for your performance in the bedroom and for your cardiovascular health. Let me recap. Erections don't always need to be rock hard, but they do need to be firm enough for satisfying sex. That's a level 3 or higher on the erection hardness score. Softer erections may still work, but they can be a red flag for circulation, hormones, or lifestyle issues. And the earlier you respond, the better the outcomes for both your health and your confidence. So here's my question for you. Have you noticed changes in your erection strength over the years? Do you think it's just age, or could it be something deeper like circulation or stress? Share your thoughts in the comments, because by talking about it openly, we reduce the stigma and help more men get the answers they need. And if you want to take the next step, there's a natural, science-backed way to boost nitric oxide, improve blood flow, and support stronger erections in just a few seconds a day. Thousands of men are already using it. To learn more, click the pinned comment or scan the QR code on your screen. I'm Dr. Ethan Carver, and I'll see you in the next video with more science-based strategies to help you protect your health, restore your confidence, and perform at your best. This video is for educational purposes only and should not replace professional medical advice. Always consult your healthcare provider before making changes to your diet, lifestyle, or medication.